Blood pressure. Please refrain from caffeine, exercise, and medication before the readings. Allow your patient to rest 5 minutes prior to the blood pressure reading. The patient should sit upright with their upper arm positioned so it is leveled with their heart and feet flat on the floor. Choose the proper blood pressure cuff size. Wrap the cuff around the patient's arm and use the index line to determine if the patient's arm circumference falls within the range area. Otherwise, choose the appropriate smaller or larger cuff. Now for the stethoscope, place the ear tips gently into your ears and turn them so they point slightly forward. Make sure that you focus on the sounds your stethoscope transmits. Place the cuff over the bare upper arm with the artery mark position directly over the brachial artery. The bottom edge of the cuff should be positioned approximately 1 inch above the antisubital fold. Wrap the end of the cuff not containing the bladder around the arm snugly. Lightly press the stethoscope's bell over the brachial artery just below the cuff's edge. Use the bell side of a combination stethoscope for clearest detection of low-pitched corticoff sounds. Avoid using your fingertips on the edge of the diaphragm or bell. Rubbing them around the chest piece will cause extra noise and interfere with listening. Close the adflow valve by turning thumb screw clockwise. Palpate the radial artery while inflating the cuff. Be sure to inflate cuff quickly by squeezing bulb rapidly. Inflate cuff 20 to 30 milliliters of mercury above the point at which the radial pulse disappears. Open the valve to deflate the cuff gradually at a rate of 5 milliliters of mercury per second. Record the onset of corticoff sounds as the systolic pressure and the disappearance of these sounds as diastolic pressure. When taking blood pressure, it is vital that all of these steps involved in the process are properly observed. Small variations in technique can cause large variances in measurements, even on the same patient. The only way to diagnose if you have high blood pressure is to have your blood pressure tested. Understanding your blood pressure numbers is key to controlling high blood pressure. This blood pressure chart reflects categories that will classify where you land.